Do you think we're actually generating better insights using all the data and all the complexities that we see in trials today, or are we creating more noise?
So here's what we talked about before, and we know that these trials are getting far more complex. And the more complex the trial is getting, it's the more data, different data that's happening. I think, 10 years ago, you didn't really have these data lakes and these capabilities around looking at all the metadata in not just one trial, but all trials. And I think companies have gotten so much more advanced to that, and they're able to get more of their data much quicker to do additional analyses on that. So I've seen over the last decade, yes, the volume increase, yes, the complexities increase. I've also seen the analysis and the speed with which they analyze the data increase. I think we are getting better data by virtue of more data at a greater depth. Do
Hmm.
we need to get all of that? And I've, over my career, not just here at Y Prime, but other places, I've sat in meetings where people were developing protocols, and everybody wants data, and it's understandable. You have everybody in that on that table wants to collect data, and I've seen a shift probably 3 or 4 years ago where people are now asking why. 10 years ago, no, this MD wants the data, this MD wants the data, this leadership, yeah, collect it. But now you're starting to see some changes of why do you want it and what are you going to do with it. So I think the industry has made significant improvements, but I don't think it's going to reduce the amount of data because we're getting more sophisticated on the why and the what, and the capability to collect more data is there, and the ability to get that data back quicker for analysis. I would only see that protocols collecting more data and things becoming more complex, which is interesting because the whole world is always about how do we make things simple, how do we make things less complex. But I think the clinical trials will continue to grow in complexities, but the data analysis will simplify.
So if you get someone that's actually developing a study today, what's one mistake you think they should avoid when identifying the right technology vendor?